My name is Claire Watton, and I'm a research assistant here at the Learning Bar. I'm excited to be able to engage in the conversation of child and youth mental health with my colleagues, our guest speaker Chris Friesen, and our many wonderful members who are tuning in. So I'm going to take a moment to give you an overview of what I'll be discussing throughout the research component of this webinar. Now, essentially what I'm going to do is establish the climate of child and youth mental health in Canada today. So defining some of the key terms, summarizing the statistics, and based on that context, talk about the importance of and best practices in school-based mental health programs. I'll then provide an overview of how you can use our Tell Them From Me surveys to help establish the climate of mental health in your specific school or district, so that then you will know what type of school-based mental health program will be most effective in your school. So overall, the goal is to generate a sense of or refresh your knowledge of the key research findings in child and youth mental health in Canada, and to have you start to think of the ways in which you can use Tell Them From Me survey tools to gather information about the mental health of your students. So I'll start by defining some of the key terms that we find in the literature and in general conversation on this topic. Now, according to the Center for Addiction and Mental Health is generally conceived as the state an individual is in which everything seems to be working well. So generally feeling good about yourself, having healthy, positive relationships with others, being able to function well within your everyday tasks, and being able to respond and adapt to the many challenges or changes that arise in everyday life. Now, we often hear different terms used to describe the opposite of mental health. On the one hand, we have mental health problems or mental health issues. And this encompasses changes in thinking, mood, and behavior that negatively impact an individual's normal day-to-day functioning. So if we think about this in the context of children and youth, this could mean difficulties functioning in their relationships with peers or their families, difficulty functioning in the various sports or activities that they take part in, and of course their ability to function both socially and academically in the school environment. Now, the other term that is used to describe the opposite of mental health is mental illness. And mental illnesses are those mental health problems or issues described before that severely impact an individual's ability to function, that have a particular set of symptoms and have been formally diagnosed by a mental health professional. So some examples include depression, schizophrenia, and eating disorders. So with that terminology in mind, now I'll turn to a discussion of some of the key statistics on child and youth mental health in Canada. Now, according to the Canadian Mental Health Association, at any given point in time, roughly 10 to 20% of Canadian youth are affected by mental illness. And this is the highest percentage among all of the age groups. Now, there are some specific mental illnesses that are more common among children and youth than others. And it's important to note here that when I use the term child and youth, it generally refers to the age range of late childhood into the adolescent range up to about 18 years of age. So I'll briefly describe what some of these more common mental illnesses are among children and youth. So first we have anxiety disorders, and this affects roughly 6.5% of all Canadian children and youth. Now, those with anxiety disorders experience excessive and unrealistic feelings of anxiety, fear, or worry, which causes them to either avoid the situations that tend to bring about those feelings or develop compulsive rituals in order to help lessen the feelings of fear and anxiety. Now, of course, there are different types of anxiety disorders, and some of those include generalized anxiety disorder, post-traumatic stress disorder, social anxiety disorder, and obsessive-compulsive disorder. Another mental illness common to the period of childhood and adolescence is depression, or major depressive disorder, which affects roughly 5% of males and 12% of females. Now, depression is a mood disorder that is characterized by feelings of intense despair, sadness, and worthlessness over an extended period of time, which is typically at least 2 weeks. Another common mental illness is conduct disorder, which affects roughly 4% of children and youth. Now, in brief, conduct disorder involves a sustained state of aggression to the point where it becomes very problematic for the individual and those surrounding the individual. So those with conduct disorder often make threats to or actually harm other people, animals, or objects, and often have trouble understanding how other people think and how to effectively communicate what they're feeling, which is particularly problematic and frustrating for the individual. Eating disorders are another common type of mental illness among children and youth, and they involve a distorted perception of one's body image coupled with harmful behaviors to manage food and weight. We generally see eating disorders broken down into anorexia, which involves the restriction of food and affects roughly 1% of Canadian children and youth, and bulimia, which involves uncontrollable binge eating followed by purging, and that affects roughly 3% of children and youth. Schizophrenia is also among the mental illnesses common to Canadian children and youth. Affecting roughly 1% of the population, schizophrenia involves periods of time called episodes in which one can experience an inability to decipher between what is reality and what isn't, otherwise known as psychosis, which can involve seeing, smelling, hearing, and feeling things that are not there. These episodes can also involve the inability to think and communicate clearly, and often, left untreated, the individual has a very difficult time functioning in their day-to-day activities. So there are, of course, many different mental illnesses that Canadian children and youth experience, but here I've outlined some of the mental illnesses that the students in your school or district are more likely to experience than others. Now, what is particularly troubling is that in Canada, only 1 out of every 5 children and youth who require mental health services will actually receive them. In light of this, there has been an increased interest in recent years into school-based mental health programs. So when we are talking about school-based mental health programs, we're talking about those programs implemented at the school level that are aimed at one or more of preventing mental health problems, intervening when mental health problems are occurring, and promoting positive mental health. School-based mental health programs have such great potential, and I'll outline some of the reasons why. So first, children and youth spend a substantial amount of time within the school setting. So this makes access, both accessing children and youth at risk for or that are experiencing mental health problems, and then the students having access to mental health services, much easier. Further, applying existing school structures and practices, for example, mandatory attendance and homework completion, to mental health service delivery helps to eliminate the issue of discontinuation of treatment, because students have some external motivators to participate and stay engaged in the program. Another benefit of implementing mental health programs in the school environment is that through class-wide instruction and activities, higher-risk students can benefit from observing how their peers behave in certain situations, respond to challenges, and manage their emotions, so the skills are being modeled for them among their peers. And finally, school-based mental health programs help maximize the positive mental health development for all children, not just those who are at risk for or already experiencing mental health issues. Now, thinking of the ways in which you can implement a mental health program at your school can seem particularly overwhelming at the outset, just knowing where to begin and what type of model to follow. But thankfully, the Mental Health Commission of Canada issued a report September of 2013, which is readily available online and contains a summary of school-based mental health programs in Canada. So in particular, this report summarizes what school-based mental health programs tend to look like in Canada, but more specifically, what the strengths and weaknesses are of different models and what the best practices are. So there are 2 particularly useful findings from this report. The first one is that universal programs are most effective. So when the program is implemented at the school-wide, grade-wide, or class-wide level. And some of the reasons why these types of programs are most effective are that in using this model, where participation is open to all students in a particular school, grade, or class, no individual students are singled out or pinpointed as being particularly vulnerable, and it helps to reduce the stigma associated with seeking mental health services. It's also particularly helpful for teachers and school administrators to be able to integrate the program into their existing school day and possibly as part of regular classroom activities. The other key finding from this report is that the most effective school-based mental health programs focus on social skills training or social emotional learning. And this is where students are taught about or given opportunities to practice and discuss effective coping skills, conflict resolution and appreciating perspectives of others, stress management skills, learning how to set and make a plan to achieve goals, and how to be more self-aware, among many others. So these are sort of the best practices outlined by the Mental Health Commission of Canada. But in order to determine how to specifically structure the school-based mental health program at your school, or among the schools in your district, it's important to have a sense of the types of issues students tend to be facing and what the general climate of mental health looks like in your school or district. So with that said, our TTFM surveys can serve as a useful tool to help you gather information about the mental health of your students. Now, the purpose here is not to be diagnostic and identify mental illness among the students in your school or district, but rather to be able to establish what the trends are or the key problem areas among your student body as a whole. So with that said, what I'm going to do now is take a moment to discuss some of our survey measures and what information they can provide you about the mental health of your students. So first we have our emotional health indicator, and it's made up of 3 measures: depression, anxiety, and self-esteem. In terms of depression, we ask students 6 survey questions in which we have them think about the extent to which they experience feelings or display symptoms of sadness, discouragement, and inadequacy. Some examples of those survey items include, "I feel lonely," or "I cry without a good reason." And these are statements in which students indicate how much they agree or disagree. In terms of anxiety, this measure is made up of 6 items as well. Here, we ask students to indicate the extent to which they experience feelings or display symptoms of excessive fear or worry. Some examples of those survey items include, "I am too fearful or nervous," and "I worry more than most kids." Finally, our third measure of emotional health is self-esteem, which is made up of 7 items asking students to reflect on their view of themselves and their abilities and their sense of self-worth. Some examples of these survey items include, "In general, I like the way I am," and "When I do something, I do it well." Now, while we do offer this explicit indicator of emotional health, it is important to understand the ways in which many of our other Tell Them From Me survey measures can inform you more indirectly about the mental health of your students as well. So I'll use the example of our student engagement indicator. Here at the Learning Bar, we define student engagement as a disposition towards learning, working with others, and functioning in a social institution. And so that includes a student's sense of belonging at school, the extent to which they value schooling outcomes, and their psychological investment in the learning process. Now, as you can see, our student engagement construct is made up of 3 different measures that target 3 different dimensions of student engagement: social engagement, intellectual engagement, and institutional engagement. Now, as previously discussed, mental health issues can impede on a student's ability to function both socially and academically in the school environment. Therefore, we might expect that a student suffering from mental illness would be experiencing any one or more of decreased social engagement, intellectual engagement, and institutional engagement. Further, research has shown that students who are disengaged are more likely than those who are engaged to engage in delinquent behavior, abuse drugs, drop out of school, and experience depression or decreased life satisfaction. So while school engagement is not a direct measure of mental health, you can use the data on your students' levels of engagement to assess the likelihood that they will experience or are already experiencing mental health issues. To further emphasize the link between student engagement and mental health, Dr. Wilms, President and CEO of the Learning Bar, found through cluster analysis that students who have the highest probability of completing school are both engaged and have positive mental health, so they are not experiencing depression or anxiety and have high levels of self-esteem. What this tells us is that those who are highly engaged in school tend to have positive mental health. So again, we can use our data on student engagement levels to assess the climate of mental health among students in a particular school or district. You can see this classification of the different types of students based on their levels of engagement and mental health outcomes by using our school completion survey. Several of our other measures can tell us indirectly about student mental health in the same way that student engagement can. Some of these measures include, but are not limited to, bully victimization. So several studies have shown that those who have been victims of bullying are at an increased risk of experiencing mental health problems. On our Tell Them From Me surveys at both the elementary and secondary level, We asked students if they have ever experienced any one or more of physical, verbal, social, or cyberbullying. So, if you find that there is a high level of bully victimization in your school or district, chances are that there are students experiencing mental health issues. You can also use information about students' drug use and whether or not students have someone at home they can turn to for encouragement and advice to assess your students' risk of experiencing mental health issues. So in summary, our TTFM surveys contain both direct measures of mental health, which include our depression, anxiety, and self-esteem measures, as well as indirect measures, including but not limited to student engagement, bully victimization, drug use, and advocacy at home. This data can be used to help identify the degree of mental health issues among the students in your school and what types of problems they tend to be facing. It's important to remember here that our surveys are not used to diagnose mental illness. And ultimately, the information gathered using our tools can help inform you how to best structure your school-based mental health program.